Hello, everybody. It's good to see you this evening. My name is Dr. Jane Tobias, and I am the director of the Golisano Institute for Developmental Disability Nursing Fellowship. And I am looking forward to sharing a little bit about our fellowship with you over the next hour or so. I am joined by two of our fellows, Elizabeth Eng and Lisa Depperman. And in a few short minutes, after I'm done giving you my presentation and my little spiel, they're going to actually have a really fun part of this presentation, and that is share their experiences with you being a Golisano Fellow and how that has progressed since they've finished their fellowship and the impact they have been able to make, the connections they have made, and the roads that they have traveled to get to where they are. So I am very grateful for their support. I know it's approaching the 4th of July holiday, so I'm also grateful for all of you joining us this evening as we approach kind of a longer weekend, and hopefully everybody's going to get a little R&R as we progress. So I see we still have a few more folks that are coming on board, and I welcome them. I do want to let you know that this presentation is going to be recorded. We will post afterwards where you will be able to access that recording for viewing in the future. At the end of my presentation, you also will find information with how to reach out to me if you have any direct questions to our institute as well. So we will always be connected. Do not worry about that. And I will also be hosting a second information session in September, later in the month of September, once the kids are back to school and we've settled into kind of life again after our summer break. So don't worry, you will always have access to us. I am going to get started and share my screen to bring up just again a very brief presentation. I am more about actually talking and answering questions. So, what will happen after I present and we have Liz and Lisa share their experiences? I'm opening the floor up to you. You can raise your hand, you can enter a question in the chat, but we are happy to take all questions. And if you think of something afterwards, please, again, you'll have my email address at the end of this presentation. Don't hesitate to reach out. I am happy to get on a phone call and get on a Zoom with you. So let's get started and let's talk about this nursing fellowship, which again, I am the fellowship director. I am also a Golisano fellow. I was a graduate of our first inaugural cohort and took over being a director of the fellowship about a year ago. And you will see as we move through this, just the impact being involved in this institution and also in this fellowship has had on me. So I first want to kind of lay the foundation of, who are we? What is the Golisano Institute for Developmental Disability Nursing? And I can't do that without acknowledging and appreciating Tom Golisano. I'm going to share a little bit about him, and he is the reason I'm here today speaking to you. He is the reason that the Golisano Institute for Developmental Disability Nursing, which is housed in St. John Fisher University, is currently in existence. So some of you may be familiar with his name, some of you may not be familiar with his name, but Tom Golisano is both an entrepreneur and a philanthropist. And through his vision and generosity, the Golisano Institute for Developmental Disability Nursing was established in 2018 as the first institute of its kind in the nation. And the Institute is dedicated to transforming nursing education and improving health outcomes for people with intellectual and developmental disabilities. And when I say first in the nation, it's because we are first in the nation as a nursing focus. The profession of nursing is grounded in this institute and also in this fellowship. Mr. Golisano recognized, however, that there was a gap in nursing education. As many of us know, we're not taught how to care for folks with IDD. We learn it on the job, so to speak. It's not part of the NCLEX examination when you become an RN. And we recognize that. And really, it's one of our fundamental goals is to push that and to make sure that all nursing curriculums have this education embedded. And I think a coup for us would be for it to be included in the NCLEX. And we work every day to work towards that goal. So, with Mr. Golisano's philanthropic donations, we were able to establish the Institute. From the Institute, the fellowship came to be. And fellowship is a program really that's brought nurses from across the country but also across the world. We have fellows that have come from Ireland. We have subject matter experts from Canada. We've had some fellows from Japan. So we really are an international cadre of nurses who are passionate about advancing inclusive and person-centered care for our population. And what I have come to see since we have now just graduated our third cohort of fellows is that the ripple effect is there for the work that we're doing in this fellowship. And it extends far beyond just an individual fellow. We're starting to see momentum gather. It's starting to reach our families, our patients, our students, the communities in which our nurses are coming from, and most importantly, future generations of nursing. We are helping to prepare that workforce pipeline to go out there and really provide inclusive and patient-centered care for those with IDD. So I think at the end of the day, I just want to say again, thank you to Mr. Golisano and also his investment in our institute, his investment actually in the community of IDD care in children's hospitals, of which he's just been very generous in his philanthropic donations, has extended beyond this. It has become a catalyst for change. And through the Institute and the fellowship program, he has helped create a movement of nursing leaders that are committed to improving the health, dignity, and quality of life for people with IDD. So I spent a few minutes on Mr. Golisano. You understand why. Without him, we wouldn't be here this evening. And the foundation, the Golisano Foundation, has continued to support us. So where are we? This fellowship program, as you'll learn, is virtual. You will not be physically traveling anywhere. However, if you choose to, we are located in Rochester, New York, and we are within St. John Fisher University. We are hosting our first nursing summit in September of 2027. And if you follow us on LinkedIn, you'll stay in touch with details about that nursing summit. That will be an in-person nursing summit, and it will be in Rochester, New York in September, the end of September. What I will tell you is Rochester in September can be a beautiful time of year. And we also planned it to avoid any blizzards. So we had a very short window to work with. And again, we hope that you will join us next September for that nursing summit. Or again, if you're from the New York State area, stop into our offices in Rochester and visit us. We would love to meet you. I think it's important that we just talk a little bit about our mission. And the mission of the Golisano Institute for Developmental Disability Nursing is to lead the preparation and practice of an international cadre of nurses and healthcare professionals equipped with the knowledge, evidence-based skills, and competencies needed to improve the health, the well-being, and the care of individuals with intellectual and developmental disabilities throughout the lifespan and through systems of care. So I think what is important to note about our mission here are a few things. I did mention that we are not only national, but we're international. And you'll see that it's nurses and healthcare professionals. One of our tenets is interprofessional collaboration because we all recognize that in caring for our population, it just can't be nurses. It has to be OT, PT, it has to be behavioral analysts. And we have several fellows that have applied from outside the discipline of nursing. So if you have a colleague that is a physical therapist or an occupational therapist that is passionate about this population and caring for them, please encourage them to apply to this fellowship. As I said, we are housed in nursing, but we also recognize that we can't operate on an island or a silo, and that it's important to bring all of our colleagues in throughout all of the professions. And also, you'll note that we are throughout the lifespan and throughout systems of care. I myself am a primary care pediatric nurse practitioner. My scope of practice goes up to 21 years of age. I can't tell you how much education I provide in my university at Thomas Jefferson University to my adult colleagues, in my family nurse practitioner program, in my women's health program, because it's important to me. It's important to me to learn, to educate, and to think about throughout the lifespan and also systems of care. Our fellows are from everywhere, as you'll see shortly in a couple more slides. We have fellows that are academic, that teach like myself in an academic program. We have fellows that work at the bedside that are in their day to day. We have fellows that are in community-based organization. We have leaders that are nursing leaders. They're CNOs, they're charge nurses, they are nurse managers. And when I kind of go through the persona of a Golisano Fellow, you're going to see that we don't really look at that. We're more interested in the why of why you're choosing this fellowship and why it's important to you. So let's talk about the fellowship for a moment, and we're taking it beyond the classroom. Our fellowship is asynchronous, it's virtual, but it's not lectures, and we pride ourselves on that. We bring in subject matter experts from around the world and from around disciplines. As I said, interprofessional collaboration is a tenet of our fellowship. And it's important to us that we learn through experience, that we learn through sharing, that we learn through persons with lived experience. The strategic priorities that we choose to focus on first are dissemination. Part of the fellowship is doing a project, and it's kind of a quality improvement project, a change project. You're going to identify something that is important to you, that you've thought about, and we're going to pair you with a mentor for the entire year. And the two of you are going to think about how to bring that project to life. And I'll get into that shortly. And my fellows, Liz and Lisa, will also share some of that with you. But I will tell you that many of our fellows have gone on after the fellowship and have presented on their project at conferences, have presented to their local organizations, grand rounds, have made posters and taken them to their own professional organization conference. And these are fellows that really weren't embedded in academia. They're bedside nurses, but through the mentorship and through a lot of leadership skills and leadership discussions that we have said to themselves, hey, like my work is important and I want people to know about it. Next, one of our priorities is systems impact and really scaling outcomes from those discrete projects to organizational transformation. And I wish all of you could have been here a couple weeks ago when we had our final week of our fellowship and all of our fellows were able to present their projects and what it has meant to the organizations that they come from, and what it means in months and years to come for being able to take that work and disseminate it and to make it on a bigger scale. But more importantly, to change outcomes, to improve safety for our population. And then lastly, health equity is always a priority, both of the Institute and the fellowship, and it directly aligns the work with global IDD health equity goals. We're very fortunate in our institute that we have a policy expert, Dr. Deborah Napolitano, and she shares her knowledge and her expertise with our fellows throughout the year about not only how to be an advocate with a voice, but how to impact policy in the state you're from. And we recognize the challenges that every state is different. All laws are different, right? All nursing is different from state to state, which doesn't make it easy, but we try and make it easy. And an exciting part of our fellowship is to have a seminar dedicated to how I can use my voice. What does a 30-second elevator speech look like? How do I write a letter to my representative in my state because I have a concern about a certain bill that is going through? And we help you with all of that. We provide you with strategies and tools for you to take back and to share with your colleagues. So the fellowship itself, I like to think of it as throughout the year, we learn change. And by that final week at the end of a year, we're leading change. And we do a lot of focus on leadership skills and how to be confident and how to use our voices as leaders. So, leadership we look at is really being impact driven. Our fellows move from studying change to executing it. And we saw that. It's every fellow produces a shareable output, and many have presented at national summits. They've contributed to real world systems change. They've had publications. As I said, we're hosting our first global summit in September of 2027. And hopefully, you will be there to join us and hear from some of our fellows and the work that they have done. As we look at the program, there's a couple key features that I'm just going to touch upon. So first and foremost, it is a virtual model. I will tell you when I applied for this fellowship, it was right after the world shut down during the COVID pandemic. So we had to be virtual. And actually, it was a blessing because I work full time. I was raising a family. I had two daughters that were in middle school and high school. And I thought to myself, I don't know if I could do this fellowship and have to travel somewhere. So having this virtual model that ended up being very not only engaging but immersive was ideal. This is an immersive learning experience. You're going to participate in two virtual fellowship weeks. The first week in June of 2027, we have a kickoff, and right now the tentative dates for that are June 7th through the 11th. And then we conclude the year-long fellowship with another week, and that tentative date is June 5th through the 9th of 2028. The fellowship weeks, you'll be immersed and you'll be hearing from subject matter experts, from former fellows, from mentors. And then throughout the year, we meet monthly, and those sessions will be led by mentors, by Golisano team members, such as myself, our executive director, Dr. Holly Brown, Dr. Deborah Napolitano will be there for a session on policy and advocacy. The project I already kind of talked a little bit about, but each fellow will design and implement a project that will address a gap in care for people with intellectual and developmental disabilities. Now, part of the application process, which is coming, will be to share with us a thought that you have. And trust me, thoughts change, ideas pivot. I started out with one idea, and my mentor, who I was working with, told me that I needed to just go for some more low-hanging fruit, that I wasn't going to be able to change the world in 1 year. So the project is something that is special to you. As you'll hear from Liz and from Lisa, you're doing this project for a year. So you really have to like the idea of it because you're going to be immersed with it. Now, we're not just putting you out there to come up with a project. We are going to pair you with a mentor. And this was my favorite part of the fellowship. I was given a mentor and it was Dr. Shirley McMillan from Toronto, Canada. Surrey Place, who just was a powerhouse in kind of primary care. And that's where my project was focused on. It was focused on systems change in a hospital organization and really looking at the primary care aspects of it. We look at your project and we have mentors that are former fellows. We have mentors that are experts in the field of intellectual and developmental disability care and nursing. Some of our fellows are not even nurses. Some of them are PhDs, they are policy, they are advocates. They really they're so well-rounded and they really meld well with our fellows when we assign them. You and your mentor will get to know each other very closely. We will provide the introduction, and then after that, you take it from there. And typically, the relationship is that you meet once a month with your mentor, and that is a virtual meeting. Sometimes you meet more frequently. In my project, I met frequently the first couple months till it really was kind of set. And then after that, Shirley and I touched base monthly until the very end, and then we met a couple more times more frequently. But your mentor is there to guide you. And I think the most important aspect of mentorship that I left with was I had a lifelong friend. I had a lifelong expert that even after my fellowship concluded, I continued to reach out to my mentor and to touch base. And as you know, our community is small. So you'll be bumping into your mentor, believe it or not, during webinars, if you attend any conferences, any of those things. Our next key feature is about leadership. As I spoke earlier, leadership is one of our tenets, and leadership development, we really place a focus on building skills in advocacy and systems thinking and leadership in disability inclusive care. We're fortunate to have Dr. Ann Carey, who was a fellow from our very first cohort and also just a dynamo in the area of nursing leadership. Ann meets with our fellows, does a leadership assessment, and then meets with you one-on-one in small groups to kind of hone in on areas of opportunity, areas of growth in your leadership portfolio, and how to develop that. We also do peer leadership, right? During the course of the year, we meet monthly, and those monthly meetings are more focused. We do smaller group work where we break into groups of just 4 to 5 fellows. So you can get to know one another because you are from all over the country, all over the world. And that networking that you get to experience and meeting your folks from all over the world is really, really important. You're going to find at the end of the fellowship, just like with your mentor, that you're staying connected to other fellows that are in this fellowship program with you. The lived experience integration is core to who we are as an institute, and it's core to our fellowship. We learn alongside and from persons with lived experience. Corey Peels works with our institute. She is our inclusion specialist. And for our fellowship week this past June, she led a phenomenal panel discussion with persons with lived experience. So we really, really focus on that, and it is an important tenet of what we do. Also including our interprofessional community, which I spoke about earlier, in that it's important that we also recognize that there are experts across disciplines, whether it's physical therapy, social work, occupational therapy. Dr. Joseph Buhane was a faculty fellow this year, and he's a respiratory therapist and also is a simulation expert and does a lot of work like Lisa Depperman in her project on disaster preparation. So it's important that you learn not only from nursing, but from also outside our community. So that was a lot I just provided you with, a lot to think about. Your head is probably spinning. I apologize for that. but I just wanted to kind of illustrate the persona of a Golisano Fellow. And we look at our fellows as transformative leaders. Our fellows come from diverse roles and backgrounds, and our fellowship is designed for all, from RNs to the PhD researcher to the policymaker to the nurse working in a community-based organization, the public health nurse. It's designed for all and it's designed for all settings. We use holistic selection in our application process. As I said earlier, it's more about your passion, your empathy, and your potential for impact than your academic history or your degree alone. I am more interested in your why than anything else. And on that application, you are going to have to answer a question about your why. And a lot of people get nervous about that. And my advice is you speak from your heart. I am not looking at, grammar. I'm not looking at APA format. I really am just curious to know why our fellowship, and why do you want to be a Golisano Fellow? And then lastly, we have a global community. Our fellows are from all over the world, but they're also from all over various settings, whether it's hospitals, universities, international sites, community-based organizations, public health organizations. This past year, Ashley Asbury was from the ARC. So again, we want to just know your reason and your why, and don't worry about the rest of it. Don't worry that you haven't written a paper in 25 years. That was me, believe it or not. I was a clinical nurse. I'm at the bedside. I'm in primary care. I'm giving shots. I'm talking about constipation. I'm not doing reviews of the literature. And it was a little intimidating when I first thought about applying. But as soon as I met with the team at Golisano and I met my mentor, I knew that that wasn't a concern that I needed to have, that I was going to be supported the entire year. So kind of the nuts and bolts, the application process. So the application period will open on September 15th through November 1st, and it will be an online application. You will be asked to provide 2 letters of support. One letter is from a current supervisor, and really that letter is just to say that I know that Susie is applying to the fellowship, and I know what the time commitment is in terms of the virtual meetings once a month and the fellowship week each June. The second letter can be from anybody of your choosing. It might be from a work colleague, it may be from a physician that you worked with, a former supervisor. It could even be from a patient or a patient's family that you cared for. We hope to have all of our acceptance notifications out by December 12th of 2026. And again, that will be for the following June of 2027, which is when you'll start. There is a program fee that is associated with the fellowship, and that fee supports participation in fellowship activities as well as the programming involved in it. Upon your acceptance, however, there will be additional information about financial support that may be available upon acceptance. We don't want finances to be a barrier from this fellowship, and also that was part of when the Institute was developed with the financial and philanthropic support of Mr. Golisano. So again, information is forthcoming regarding that. The program overview, this is a 12-month program. It runs from June of 2027 and concludes of June of 2028, all virtual with live synchronous sessions and monthly meetings occurring from July through May, and those meetings will be 2 to 3 hours apiece. We haven't decided on a day or a time yet. That will be once we've looked at the application pool, because again, because we're national, East Coast, West Coast, and international, that's where some of the timing needs to be thought of a little more thoughtfully. We don't need our colleagues in Ireland on a meeting with us at 11 p.m. at night or at 4 in the morning. So again, that information will be more set in stone later in the year. And again, this is my information as well as our website at the Golisano Institute for Developmental Disability Nursing and a general fellowship email as well. So I am going to stop sharing right now. And what I would like to do is just have each of my fellows introduce themselves and share a little bit about their experience with our fellowship. Probably they will answer more questions than I was able to that you're already thinking of. And then we'll open it up for both of you. So, how about Liz? I start with you.
Okay, great. Thank you. And I do want to start out by acknowledging this is not a fancy background. I am indeed in my car. My family is currently at a minor league baseball game. It is 99 degrees outside, so I am happy to come and spend this hour with you all in my car with my air conditioner on. It does also demonstrate that the fellowship doesn't come from like an ivory tower of nursing where we just think everything's perfect. It's very much grounded in real life. And so it is what it is. I was in the second cohort, so I keep looking at my certificate above my desk sometimes to confirm, yes, I got that in 2024. So I was from 23 to 24. Whenever I started, I was working night shift as a bedside nurse on an observation unit in a level 1 trauma center in an urban environment. And by the time I finished a year later, I had transitioned to day shift, was actually getting ready to transition to a heart failure clinic. I do still work in an advanced heart failure clinic as a clinical nurse, but I only do that one day a week because I recently moved to a new position where I am the director of medical outreach at Best Buddies International, and I am able to do that as my full-time job, but maintain a clinical practice.
Thank you, Liz. And Lisa, would you like to introduce yourself and a little bit about your experience with the fellowship, having just left us a few weeks ago?
Yes. Hi, everybody. So I am Lisa Depperman. My role is I am a nursing faculty person at a small private school, and I teach nursing classes. I teach the fundamentals, like the freshman classes, and then I teach. I do clinical at a place for people with IDD. It's a residential and day school. So I take the students to their home, to a home, and then to school with those same students. It's a blast. And then I also teach a gen ed class on disabilities. And so that is my thing. My why really started with my son, who has Down syndrome. And he kind of led me into my project because he's voraciously independent and had a run-in with the police. So I really started to think about how do EMS personnel talk to individuals with IDD. And so that kind of led me to a mini mass casualty simulation, which really isn't about having a run-in with the police, but just in looking at everything, that really seemed like an important thing with evacuation and whether it's in the clinical setting or their home. So my experience with the fellowship was beyond my dreams, really. I didn't exactly know what to expect. I was very much an open sponge to wanting to learn, but I had no idea what that learning would look like. And the speakers that came, the books that we read, working with my mentor, I had the incredible fortune of having Dr. Deborah Napolitano as my mentor. And she actually came to my simulation. Like, that's the kind of woman she is. And I learned an incredible amount from her. And she just was there for me. We met like every 2 weeks, basically. And she was just there for me all the time, whatever I needed. Still, we're trying to publish the project, so she's still there. And so that was great. And the other thing that Jane said that I kind of wrote down when she was talking was the collaboration with the other fellows. Those little meetings where we got to know each other and what people's work life was, their personal life, their having kids, with IDD or a family member or not, and then just having the experience when I was doing my project of not knowing so much about simulation stuff. One of the people I got in touch with, and she met with me and helped me out and was really very instrumental in my project. And then I was reading an article for my project, and she was one of the authors. So it's really, a small community, like Jane said. So we do all kind of come full circle.
Thank you, Lisa. So I'd like to open up the floor to anybody that has a question. If you'd like to place it in the chat, you could go ahead and do that, or raise your hand. Hey, Tess, it's good to see you. Yes, so Tess says, can you give some examples of the projects completed by fellows? Absolutely, and I'm going to turn to Liz and Lisa just to share some examples of their projects, what they did, and then I'll be happy to share a few more with you. So, Lisa, you started to talk about your mass simulation, which was really quite remarkable that Lisa was able to mobilize an entire county of public people, officials, to do this, which is unheard of. So, Lisa, if you can share some of your project, and then Liz, I'm going to have you share your project.
Sure. So, like I said, I decided that I would look at this mini mass casualty situation because it really occurred to me, how do you evacuate? I know there's a lot of group homes in my area. How do we evacuate people safely from them during a, emergency situation? So I hit up two gentlemen with IDD that I know very well and asked them if they would be my victims. And they were part of the planning process from day one to completion. And so they were all in. They were able to help me, give me lots of good information. And then, police, fire, county emergency management. The goal was to get some providers. That part didn't work out, but nursing students, obviously, nursing faculty. And we were able to evacuate them and then, have a debriefing where we learned a lot about everybody's individual experience and, their individual goals of what each entity wanted to take away from it. And obviously learned a ton from the individuals themselves. So it was, when Debbie and I first started meeting, she kind of did what Jane's mentor did. And she said, you don't actually have to do the simulation. You can just plan it and do it later. And I was like, well, I'm going to do it. Let's just do it. So I felt really lucky. And the leadership part from Dr. Ann Carey, she gave me my bravery to actually go out and do this and reach people, because I could have easily been like, yeah, never mind. So I appreciated that a lot.
Thank you, Lisa. And I think one aspect of your project that is exemplified one of the tenets of our fellowship was involving persons with lived experience from the beginning, from the planning, which was, I wish I had the video to share. It was awesome. Can you also just quickly share the secondary benefit of doing your project and what came out of that?
Yeah, so the unexpected thing that we didn't anticipate was, like I said, everybody kind of shared their own what happened. But the father of one of the individuals, both the gentlemen were in wheelchairs, we were waiting and waiting for him to come, and he didn't show up. And then I was texting him, and all of a sudden he came and he said, well, the thing is, the New York State Electric and Gas, I forgot to mention them, they were there, found 2 gas leaks at the house. And so that kind of slapped everyone in the face of, wow, this really made an impact on these gentlemen.
Yeah.
So,
yeah.
And their caregivers, because we involved them as well. Their direct support professionals were victims and part of the whole thing too.
Thank you, Lisa. And Liz, I'm going to have you share.
Yeah. My project honestly was born of horror. I started working at the bedside again in 2021. I had taken some years off to be a stay-at-home mom, get my children stabilized medically. And so coming back to the bedside, especially after having been in like pediatric circles with my children, just saw honestly human rights violations, inadequate care, just and so my passion was equipping the generalist nurse to better be able to care for patients with IDD, but really anybody, not just nursing, going across anyone who's patient facing. And so my project was developing education that all of us that are in the IDD world, if they saw the education, would be like, this is such low hanging fruit. Like you've essentially told them nothing. But that is because there's such little knowledge in the generalist on how to care for patients with IDD. In my hospital system, the vast majority of people still chart it as MRDD. And so even having to dial it back a little bit to how do we even speak about and to these patients. So I developed an online module and got buy-in to be able to release it to my health system, which contains 5 hospitals. And I think there's like 4,000 nurses in the system. And so that was what my project was. I will say, being in the second cohort and getting to see everybody's projects. And then one of the fun things is as a fellow, I still have access to all of this knowledge and this information, which as a nerdy nurse makes me so happy. I can jump in on those monthly calls and get great information. But seeing the third cohort also, there is not, you can be you and still do this fellowship really well and do a project that you actually care about. When I first joined, I was actually a bit intimidated because I was a bedside nurse with the BSN, and I'm sitting with all of these MSNs and PhDs and DNPs and academia and advanced practice. But honestly, every level and every environment of nursing touches the lives of people with IDD. So we need people in every single one of those places as well. And getting to see the diversity. Some people worked on policy. Some people worked on creating better tools for individuals, creating better tools for providers. And so I will say, really, if you have a passion to serve this population, if you want extreme knowledge to go with that passion and a phenomenal network, this would be an amazing fellowship for you.
Thank you, Liz. All right, we have some questions coming in. Let's see. So Morgan, it's great to see you again, Morgan. Is there anything, and I'm going to put this out to Liz and Lisa, is there anything you wish you knew or had done to prepare for the fellowship?
I just wish I knew about it sooner. So I could have been in the first cohort. I will say I was awarded my fellow status in June of 2024. I also finished my MBA in December of 2024. The MBA costs a lot more money, and I've had such returns on my fellowship. The dividends have been unmatched. And so for me, I just wish I would have known about it sooner. But there wasn't any particular preparation that I needed to do to be able to jump into the fellowship.
And Lisa?
I agree with Liz. I think the only thing I wish I knew ahead of time was the books that we were reading for the fellowship. I'm a very slow reader, and I personally was intimidated when got all these titles and bought the books, and they were big. Some of them were big. You know what I mean? So for me, I was not prepared for that. And I think if I was applying now for something that was going to start in June, I would love that reading list ahead of time. But that's just a me thing.
Note to self, Lisa, I filed that away. And I will say there are a couple books that we do have our fellows read, and I was the first cohort, and there were many more books, and they've been trimmed down for that reason. But and there's also a couple of movies, but the movies are fun that we do watch and we talk about. But
And the books were fabulous. Don't get me wrong, they were. I just was nervous I wouldn't have enough time to
yep,
finish them. Yeah.
yeah. All right. Thank you both. So, Megan Carter, does this fellowship work together with the national organizations who are advancing guidelines for care and policies for individuals with IDD, such as Developmental and Behavioral Pediatrics or the American Academy of Pediatrics section on Developmental and Behavioral Pediatrics? Are the mentors or subject experts that are offered in this fellowship from these organizations? Thank you, Megan, for your question. And to answer it, we do not directly align with those organizations. We've had speakers come in from various organizations that deliver during our monthly seminars, and provide information in that respect and have discussion and dialogue with us. We have had fellows go on and collaborate and work after the fellowship with others in those organizations. For myself, I am a pediatric nurse practitioner, so I'm very active in NAPNAP, in the AAP, and have presented at the Society for Developmental and Behavioral Pediatrics as a result of my fellowship. And that is one nice thing that I was able to, once I completed it, add when I do present and when I do submit abstracts, that I am a fellow of the Golisano Institute for Developmental Disability Nursing. I don't know if that completely answers your question, but again, in the work that we do globally as an institute, and it kind of dovetails into your second question about the competencies. Um, the institute work we do does align, for example, with the competencies. The fellowship, as you know, we look at 4 competency domains of clinical practice, of education, policy and advocacy, and also of leadership. And then for those that may practice in the academic setting, in terms of competencies, we also are delivering disability inclusive care in that respect. So there is competencies that are woven into the fellowship throughout the fellowship. And Christian Weiser, can you share a little bit about how your projects evolved and resources available through the fellowship from initial concept to a fully implemented project? I'll just start with some of the resources that are involved. So I know in my own experience and in working with the fellowship for several years now, some of the fellows don't have access to a library to do the review of literature with. So we are able to help with that through St. John Fisher University in terms of a review of the literature. All of our mentors have access to their own resources with the organizations and the universities that they are aligned with and affiliated with, so they are able to provide support there as well. And Liz and Lisa, do you have anything to add about that in terms of the evolution or resources for your fellowship projects?
I will say the way that mine evolved, initially it was going to be present this education and then see if we see any appreciable difference in self-perceived competence and confidence caring for patients with IDD. But that's not particularly revolutionary news that whenever you teach people how to do something, they get better at it and feel more confident doing it. And so mine pivoted, and I did, when I was going through the literature review, there is, even though there's a paucity of research in general, the research we have, there's a lot saying what we need to do, but there really wasn't anything that said, okay, but how? And so that was something that I did receive guidance on. How did you actually go from a night shift nurse on the floor saying we have to do better to having education available to 4,000 nurses and all the other ancillary staff in the system? And so, and I did get a paper published from it that talked about how do you use change leadership to take an idea into action? How do you get that buy-in? And so that was what I received. I will also say it had been 20 years since I had used APA. It has changed. I am also not a statistician. And so Melissa Bourne, my mentor, was instrumental in helping me with some of those. I didn't want to get caught up in the weeds. I wanted to keep working on the work, but those weeds were also important. So she helped me with that.
Yes, the statistician weeds are very important. And we talk throughout the fellowship about outcomes and evaluation processes, right? It's just doing the work is kind of the fun part of creating and implementing change, but you have to show the data at the end of it to make it stick. So many of our mentors, as I said, have access to statisticians. Have access to libraries, have access to writing centers, or have done, so much writing themselves that reviewing and doing APA format and such is just kind of second nature for them. So, Dr.
Just one time, can I just add one tiny thing to that? I think the Golisano people in general were a huge resource. Anytime, so Jane would constantly remind us, this is the due date. This is what you need to be working on. This is what is coming up next, so that we didn't feel like we were just shoved into this and lost with our projects. And Jane, Holly, Katrina, the whole team was there if we needed them as resources to point us in the right direction. So I felt that support was phenomenal.
Yep. And we try and we recognize that our fellows, I think all of us in nursing wear multiple hats. So we're doing many things at one time. And again, my goal is to support all of you in the fellowship and sending those reminders and just saying like, hey, happy to hop on a call. Lisa completed her fellowship and we met last week to talk about designing a poster and how to do that and how does it look. So it speaks to the networking that I spoke about, in that you leave the fellowship with lifelong colleagues and friends that I have reached out 2 years later and said, hey, don't know if you remember me from the fellowship. It looks like we have some similarities in projects we're working on. Would you mind hopping on a call so I can hear a little more about what you're doing? And it's like, hey, yes, our world is small. And to know that there's others out there that have a similar interest is comforting in a way and supportive in a way. And again, I hope that I've designed the fellowship in a way in which you do have that collegiality and you do have that level of comfort and that feeling of being in a safe space to say, listen, I'm a rock star at the bedside, but please don't ask me to write a paper. It's been 20 years. We all have a little bit of that imposter syndrome, and we're not worried about the imposter syndrome here. We're worried about, what's at your heart, what do you want to work on, and we'll work together towards that goal for you. So there's a couple questions, just looking at them collectively, about the fellows, how many are in a cohort, what do our numbers look like? In the past 3 years, our cohorts have varied, I'm going to say 20 to 25 fellows. And that's what we work with. We really try at this point to stay 30 and under. And the reason we do kind of put that cap on it is because this is a personalized experience. You are working one-on-one with a mentor. And we don't want to water any of that down by spreading ourselves too thin. We want you to have that because, as you heard Lisa say and Liz say and myself, that experience, that year-long experience where you're able to have access to somebody. And I say we meet monthly, but it can be whatever your pacing is invaluable. And you just learn so much about it. So I see Kenneth here. How many fellows in a cohort? Are there peer interaction opportunities outside of didactic and mentor-mentee encounters? So yes, Kenneth. The second, I think I answered the first part about the fellows in a cohort. And in terms of interaction, that's really what I put a lot of thought and focus on when designing your curriculum for the year. I want you to have small group opportunity every month. And again, those monthly meetings are 2 to 3 hours in length where you're working with 4 to 5 fellows and a mentor or a faculty fellow or a member of our team that's facilitating that discussion, where you get to know that Lisa is more than just Lisa Depperman, MSRN on a screen. I know about Lisa's why for doing the work she's doing. I know that Lisa lives in New York State. I know that Lisa works here. I know that when she was working on her project, she hit a snag and needed to rework this. They're the important aspects of this fellowship, the human side of it, where you get to know your colleagues alongside of you. This fellowship cohort is, I think, very fortunate because you're coinciding with our first summit, our first nursing summit, which will be happening in September of 2027. It's not mandatory that you attend that summit because it is in person, but we do highly encourage it, and we would talk more about that as time goes on. But it's an opportunity to work alongside members of your current cohort, former fellows, experts in the field, where we're coming together at this summit with two very important action derivatives. We're looking at systems transformation, and we're also looking at nursing education through the competencies, of which myself and Dr. Holly Brown, our executive director, are conducting kind of some research, a Delphi study now to really solidify what are IDD competencies in nursing education. More to come on that. But again, there's opportunity there as well to come together. And also in those monthly meetings, we do a lot of small group work. Okay, let's see here. What lasting opportunities are available to fellows after completing the program? Is there an active alumni network or ongoing collaborative projects? Lisa, I saw you shake your head.
Yes, so there are also, correct me if I'm wrong, monthly kind of what do you call them? Meet and greets, right?
Yep.
Where past and current fellows meet virtually as well and kind of just talk about whatever comes up. It's really informal. It's really lovely. If something came up at your work or you have a question, or just that's another way that people get to know each other personally. I think those are other ways that people collaborate also and say, I'm working on this project. Does anybody know anybody who's doing this? And then we network with each other. So yeah, that's big.
Yeah. So as Lisa said, we do have a month. We have on LinkedIn a Golisano Fellowship group for fellows. And then we have our general public Golisano Institute for Developmental Disability Nursing. And we do have monthly meet and greets where we come together. They're from 12 to 1, so kind of hoping over the lunch hour. And we're also currently just getting started a webinar series as well. So many opportunities to continue with connection and collaboration after the fellowship is done as well. There was a question here from Lisa that I would like to know in general what the workload will be like in terms of reading an assignment. Lisa, that is an awesome question because that was a concern of mine when I applied to the fellowship. As I said, I was working 2 jobs, full-time in academia, and my other job, I was still practicing clinically and raising 2 teenage girls and, 3 dogs, and how was I going to fit this all in? And the virtual format was extremely helpful in doing that. And I felt very, very manageable. The assignments, your assignment really is your year-long project, and that year-long project is broken down into increments where, September, you should have kind of just a brief review of the literature done that looks at the why of your problem. We give you step by step, and your mentor is also working with you step by step to help you work through that and make sure you stay on task. Reading, there was a couple books to read. Again, I liked Lisa's idea about putting them out much earlier for those that want to get a head start on it. But in developing the curriculum, I'm very thoughtful in looking at um, what we're doing month to month. And I make sure that if we're having a book club discussion in November, I'm not also doing another book club discussion in December. And I'm also recognizing that from November 15th to January 5th, people are busy, right? Kids are home from school, there's holidays going on. So we tend to have speakers come in during that time. So you don't have a lot of cognitive overload that you're thinking about. Most of us, again, are working and have multiple hats that we wear. So we really do try and be very thoughtful of the cognitive overload and try and prevent that. And again, your biggest deliverable is going to be that project, which is stretched out over the span of a year. And then I think we're getting to the top of the hour. So I do want to just do one last question from Andrea here. And Andrea said that her work focuses on translating lived disability expertise into systems level change across nursing education and clinical practice. For fellows who enter with an established body of work, how does the fellowship help amplify the work beyond the fellowship and into broader institutional or national impact? Andrea, excellent question. And I think a little bit about my project as well. I entered the fellowship already working within Jefferson Health System here in Philadelphia of trying to implement education and safer clinical practice for folks with IDD. So I already had that in my mind. I already had done some work towards that goal and such. And what the fellowship helped me with and supported me with, giving me Shirley McMillan, who already was doing this work and was able to say to me, listen, these are the pitfalls, these are the barriers. Let's rethink this a little more strategically so you accomplish your goal. But most importantly, what happened for me when I delivered my project presentation at the end of the year, and you do a project presentation, a slide presentation, you have 20 minutes and a 10-minute Q&A, that the mentors and our subject matter experts that are in the fellowship program with us got to hear me speak, and afterwards reached out to me and invited me to speak at their university or to speak with their organization. And I was able to gain confidence as a public speaker, not my thing, and make more connections and do more networking. And again, started having avenues of which I could say to myself, hey, you know what, that conference coming up, AADMD, DDNA, AANP, my organizations, I'm going to submit an abstract of my project that I did and see what happens. And it just starts to flow. So again, the fellowship has a lot of connections in terms of networking, not only with mentors and former fellows, but our subject matter experts we bring in nationally and internationally that are at every session. They're there listening, they're there contributing, even if they're not presenting at that time, they are there available. So I want to just thank everybody. This hour went by very quickly for your time and your attention and your interest in our fellowship. Again, it's something very near and dear to my heart that has just been transformative for me. And I also want to take this opportunity to thank Liz and Lisa for sharing your evening with us. Liz, I'm glad you got to get out of the heat. And Lisa, your work is still continuing. You thought you had a break a couple weeks ago, but we're pulling you back in. But again, thank you, everybody. And you have my email. You know how to reach out and get in touch with additional questions. And I am more than happy to talk your ear off on a phone call, a Zoom session, Teams, whatever you're using. Have a good evening and happy 4th of July. Stay safe this weekend and stay cool. It will be hot out there.